If there is no issues with the outer or middle ear and the child has hearing loss, then it probably is happening in either the cochlea or in the transmission between the cochlea and the brain. So the cochlea is called the inner ear organ, and is oftentimes what is picked up when a child has congenital hearing loss. So that means the child's cochlea has hair cells inside of it that are not functioning. Either they were born with parts of the hair cells missing or fewer hair cells than they need to be able to conduct that sound through the cochlea and to the vestibular nerve. If the cochlea is intact, sometimes kids will have a condition called auditory neuropathy or auditory dysynchrony disorder, which means that the auditory nerve is not firing synchronously to the sound stimulation and is sending an unclear signal to the brain. So as you can see, in this little tiny organ called our ear, there are a lot of different areas that something can happen that can cause a child to have a hearing difference. If a hearing difference is occurring in the outer or middle ear, that is called a conductive hearing loss. That means that the sound waves cannot efficiently be conducted from the outside world to the cochlea. Okay, so that's a conductive type hearing loss. If the hearing loss happens beyond the middle ear, so the inner ear to the brain, it's called a sensory neural hearing loss. The sensory organ is the cochlea, the neural organ is the auditory nerve that transmits the signal. Sensory neural hearing loss. Most of the time, if a hearing loss is occurring in the outer or middle ear, it can be treated by either medicine or surgery or some sort of intervention like that. If it's in the inner ear, that hearing loss can't be treated. It can be, we can help it, we can assist the child to hear better, but it can't be fixed, if you will. I want to say one more thing about these little middle ear bones. Besides getting sticky in the middle ear, head trauma can also cause something called disarticulation, or the little middle ear bones can kind of get broken apart. So if a child has a really hard blow to the head, they fall down the stairs, for example, or not just your typical toddler learning to walk, fall over, car accident, that sort of thing, kids can lose their hearing because those middle ear bones can be damaged. But again, that's something that an otolaryngologist surgeon can actually correct. So again, outer and middle ear abnormalities or dysfunction can typically be corrected through surgery or medicine. Inner ear dysfunction typically cannot.